All set? Good morning. Thanks for joining us on a beautiful June morning in Washington State. We're very excited today. We have a special guest who's a tremendous leader in the state of Washington in the effort to save lives and break the back of the COVID pandemic. This is a young leader from Spokane who is a pre-nursing student. She intends to help save many lives during her career, but she's doing this today. It's Marissa P. from Spokane, because she has been willing to accept $250,000 today as part of our effort to encourage Washingtonians to be vaccinated. And it is an act of leadership. You know, one of the things that the longer I'm at this work, I understand how we can all be leaders. We can all influence each other. We can encourage each other. And it's particularly wonderful that the latest winner of the Shot of a Lifetime Award is a young leader from Spokane. I couldn't think of a more perfect person. I've got to know Marissa a little bit this morning. Her story is delightful. Her future is delightful. She's guaranteed us that she will stay in Washington to be a nurse ultimately. That's not technically enforceable, but I know that she will attempt to follow.
I'll do my best.
She will do her best to find opportunities in Washington State. So I am very pleased today, Marissa, to give to you this check here for $250,000. Thank you for willing to be a leader in the vaccination effort. We really appreciate it. And congratulations. Thank you very much. Marissa, could you grace us with a few comments, perhaps?
Well, like he said, my name's Marissa. I'm from Spokane. I am pre-nursing, and I'm so honored to be here, and I feel so blessed to be here. I just want to say stay healthy and stay safe and go get vaccinated.
All right. Well done. Marissa, thank you very much. We really do appreciate it. Fortunately, people are listening to Marissa. We are getting more people vaccinated today, and every time somebody's vaccinated, it means a potential life saved. And Marissa, I think that you are serving as a role model for us, because we know this will help encourage other people, particularly people of your age,
Yes.
because we know that the variants are biting some young people kind of hard. So having a young leader like this means a lot to us.
Well, thank you.
So thank you. Good luck.
Thank you.
Okay, take care, Marissa. I know we'll meet again.
Yes.
In Washington.
I hope so.
All right, there's some good news here. We're joined with Dr. Shaw today, too. Dr. Shaw, did you want to make some comments at this time or not?
Sure, Governor, if you'd like for me to do that.
Sure.
First of all, I want to join you in congratulating Marissa. It's great to see somebody who's in the field of health to be so excited about the fact that she's helping others, even in the midst of her training. And I really want to just appreciate the efforts on your work with encouraging everybody to get vaccinated. And this is a really exciting time for all of us in the state of Washington. It's great to join you, Governor, because I know next week we have a very important milestone, which is June 30th, our reopening. And, you know, we had a long briefing yesterday for Department of Health, and we shared where we were with our numbers, and we're not quite there at the 70% mark. And we're hopeful that we can get an influx of people to be able to get vaccinated, initiate vaccinations so that we can get there sooner. But regardless, whether we get there a couple of days before June 30th or we reopen on June 30th, the most important thing we want to recognize is that this pandemic continues. And while June 30th is an important milestone for all of us, our vaccination efforts will absolutely continue. And we want to make sure that people are just remembering common sense behaviors, especially not just at June 30th and beyond, but also we know the 4th of July weekend, the holiday is going to be right around the corner. Those who are vaccinated, we know, are protected. As Marissa said, they can go about their lives with a few exceptions here or there, like public transportation or in healthcare settings of not having to wear masks and things of that nature. But those who are not vaccinated, Governor, are still, we know, unprotected, and we want to do everything we can to encourage them, incentivize them to get vaccinated. And I think that is absolutely critical. We've talked a lot about the fact that respect the rules of the room for either the business or the establishment or the local jurisdiction that you're in. And certainly we want to make sure to encourage people to get vaccinated. It's easier than ever. It's free. It's available. It's right down the street from you. You can call 1-833-VAX-HELP and get vaccinated. And the other thing, Governor, if it's okay to just mention is we know the weather is going to be an issue over the next few days. And especially, you know, this is like that Texas heat that I'm very used to all these years. And I didn't think I was going to be thinking about this in Washington to this degree. But we know when it is hot, people tend to want to get together and be in cool places, in pools and beaches or indoors. And if they're vaccinated, again, they're protected by and large. But if you are unvaccinated and you're not, you know, it's hot, you're not going to be as excited about wearing a face covering, but you absolutely need to continue to do that to protect yourself. And so we are concerned about the extreme heat, not just from a heat standpoint, but obviously from a COVID standpoint. And we want to make sure everybody remembers that we need to beat the heat and also beat this pandemic. And with that, I just want to say thank you, Governor, for your ongoing leadership and support. We at Department of Health are very excited about next week, and it's been a long road coming. And as you know, I just passed the 6-month mark of my tenure here under your leadership. And so thanks for keeping me on for these 6 months. Back to you.
Yeah, thanks for your leadership. Doctor, it is an important point that we're not done on June 30th. This is going to be a continuing, ongoing effort every single day to give Washingtonians a life-saving opportunity at this vaccine. We are making it as available as humanly possible. I was in Auburn yesterday at a mall, which is down the street from so many people. This is readily available. And we are going to encourage people after June 30th, obviously, in this vaccine. But look, this is not a time to wait. If you're thinking, well, maybe one of these days I'll get the vaccine, don't wait for a lot of different reasons, one of which we have another drawing on June 29th for the next $250,000. And then on July 13th, the $1 million awardee will be drawn. So don't wait. Don't wait till the holiday season. Get your name in for this shot for an opportunity. But it is so important after June 30th. Look, we're going to continue for unvaccinated people to wear masks, certainly on the work site inside. We're going to continue to have threats. This Delta variant is coming on strong. Certain states that are not where we are, we're 9th as far as the vaccination rate. We always want to be first. And other states that are not are really experiencing upticks. And this Delta variant seems to be more dangerous in a variety of ways. You look at the experience in Missouri where they're not getting vaccinated like we are. This thing has taken off again. So this is a good day. I hope people will follow Marissa in life-saving efforts. So again, thank you for Marissa. So I want to talk about our eviction moratorium. I know we have been anxious to come up with a definitive position on this. We know that the COVID pandemic had huge economic ramifications. We have had an eviction moratorium that has kept people from homelessness. I'm proud of the things we've done to protect families from homelessness during the COVID pandemic. That's why I put the eviction moratorium in place last year. The current one is set to expire June 30th. Today I'm announcing a bridge proclamation. This will transition our state from the eviction moratorium previously in place, and it will provide a bridge for Washington families until we effectively get into place the protection against eviction systems that were passed by the legislature, but will not be effectuated for some period of time. So this is going to include not only the additional money, hundreds of millions of dollars that the legislature will provide to families and landlords to solve this problem, but as well as the protection of the bridge proclamation that I am announcing today. Now that money is a combination of federal assistance and state that has been appropriated for rental assistance directly to tenants and to landlords to help them across these troubled economic times. The bridge starts July 1st. It runs through September 30th this year. Now, there's several reasons for this order, if I can take a moment to describe this plan. More than $650 million have been available of federal funds, but they're not available today because the legislature has to get this system set up. This is in addition to the $500 million that has previously been released by the Department of Commerce. That went to local governments to help for rental assistance programs, and it provides help for 80,000 landlords and tenants. To be clear, local governments have a difficult task in processing these claims, but they're involved in it now, and they're working hard to get this done in a timely fashion. But this bridge is necessary to protect against homelessness for people while these plans are put into implementation. Additionally, the legislature passed Senate Bill 5160. That provides many tenant protections and programs designed to protect against the impacts of the COVID pandemic. These programs, however, are not yet up and running. So that includes the Eviction Resolution Pilot Program and the right to counsel for individual defendants, or tenants, excuse me. So we're looking forward to getting those plans actually implemented. So we're putting a bridge into place until these funds can actually be available and until these programs of protection against homelessness actually are up and running. So the details are going to be on the website here in a few moments, but I just want to go through how this will work. These funds and programs that described will be available in every county, and this extension is a bridge that will support both tenants and landlords during this transitional period. Now, this is not an extension of the existing moratorium. It has several new provisions that I want to go over. So here's the highlights of the bridge plan. And there's kind of two parts of this. First is past due rent that has accrued but not been paid before now, and then rent going forward. For past rent due from February 29th, 2020 through June 30th of this year, landlords are prohibited from evicting a tenant until there is an operational rental assistance program and eviction resolution program in place in their county. In addition, for the past rent that is owed, landlords are prohibited from treating any unpaid rent or other charges as an enforceable debt until the landlord and tenant have been provided with an opportunity to resolve non-payment of rental claims through an eviction resolution pilot program that we are now standing up. Going forward, for rent that will accrue after that period, starting on August 1st, renters are expected to make full payment or pay less than full rent if they negotiate a lesser amount with their landlord or actively seek rental assistance. So for rent going forward, tenants are going to be required to take certain actions that I just described. If a renter is taking any of these actions, a landlord will not be able to evict the tenant for that forthcoming rental obligation. However, if a tenant is not paying or isn't trying to obtain rental assistance from the funds that have been appropriated, a landlord can take any lawful action allowed by law, with one exception, and that is landlords must offer the tenant a reasonable repayment plan before starting the eviction process. Tenants must also be provided in writing the services and supports available to them. And I'm also removing certain types of housing from the order altogether, including hotels, motels, Airbnbs, long-term care facilities, and other non-traditional housing. Now, I've just shared a lot of information with you. You may have some more questions, and Jim is available on the call here to field some of your technical questions, and they are on our site with all the technicalities involved on this. I think these are reasonable steps to provide a bridge to the fully functioning programs that the legislature fashioned. They're fair, I think, both to tenants and landlords. Both have had economic difficulty during this period of time. And I think these are very thoughtful and comprehensive approaches that we have been able to fashion with the advice from many, many people to get us through these turbulent waters until we are in a much better economic place. And I'm glad we're going to be able to do that. Before I take questions, I do want to echo Dr. Shaw's hopes that Washingtonians will take care of their health in these extremely hot days that are coming our way. Obviously, we want people to watch out for heat stroke and hydrate, but there is one particular threat I really hope people think about. Look, it's going to be really hot this weekend, but the water's still really cold. And we have had such tragedies with drownings in the last week or so in our state. I hope people realize that that water is beautiful and blue, but it's still cold, and it's a shock. And that's why we've had people who were in the water without a life jacket on, without a personal flotation device, who might be good swimmers, but that cold water caused them to seize up, and we lost several lives. Please be careful around water, particularly these hot days, with you and your loved ones. So with that, again, I want to thank Marissa, and Dr. Shaw, Jim, and Nick are available to answer questions as well. With that, you may fire when ready, Gridley.
All right, up first, we'll go to Rachel Report with AP. Go ahead, Rachel.
A couple of questions, Governor. First, people may be seeking air-conditioned places like movie theaters and restaurants to cool off during this heat wave. So why not open fully now at those places instead of next Thursday, when we'll open even if the vaccination rate is the same as it is today? And on the eviction moratorium, with the concerns about money getting to rental assistance quickly, given the increase in state reserves from yesterday's state revenue forecast, is there a way to tap that money now to expedite the process and then backfill with the federal funds?
Yeah, an issue. The money is available today. It's just getting the processing, the grant making, the procedural aspects. That's the time problem. We have the money today. If the process is available, there's no shortage of cash in the drawer. So I appreciate your comment, but it's just not necessary. We have the cash. We just need the functioning grant making process, the application process, the clearance process to get these grants out the door. The legislature, I think, did a good job coming up with, very significant dollars to help everyone through this. It's just it takes time to stand up those programs. And I'm providing that bridge. The legislature did not provide that bridge. In fact, it actually terminated the eviction moratorium that was pre-existing. So I'm stepping up to the plate, and the executive branch is providing protection for tenants and landlords in some sense during this transition period. I'm happy to do it. I think we've done a good job thinking of everybody's interests in this regard. As far as dates to open, I have not heard anyone say that there aren't places to be cool during this period of time. We do have open restaurants. We do have many of these places are open. They might be at 50% capacity, but I'm quite confident people can find activities or shelter, air conditioning if they want to. I don't think that'll be a difficulty.
All right, up next, we'll go to Joe Sullivan with the Seattle Times. Go ahead, Joe.
I have two questions. One for Jim Baumgart. Do you have a ballpark dollar estimate for how much total pandemic debt there is in Washington State? And second question for Dr. Shaw. You don't sound very optimistic that we're going to hit 70% by June 30th. Can you give us a sense of what sort of progress we're making on a daily basis with vaccinations initiated at this point?
Jim, I don't know if we have a debt figure. If you have any information, feel free to share it. I don't have any total debt figure.
Yes, sir. We have an approximate on that. The Washington's State Department of Commerce predicts the numbers about $110 million a month. When you look at those numbers, we are probably at 1.1 or 1.2 billion dollars at this point in time, which is fairly close to the amount of money that was both federal and state funds, but will probably not be sufficient to cover all of the arrearages. But it's about 110 million a month that going forward, 1.1, 1.2 billion at this point.
Yeah, and thanks for that question about the progress. You know, let me recharacterize when you said that I'm not optimistic. I'm always optimistic. I'm actually a very hopeful person, and so I do think it's actually going to be in the hands of all Washingtonians. And if we can get those who are unvaccinated vaccinated and get those numbers in, especially when it's hot outside. It's a great time to get indoors and get vaccinated, or go somewhere where there's a pop-up clinic and get vaccinated. So I'm actually optimistic or hopeful, but I'm also watching the numbers. And, you know, we do once a week get numbers that come from our DoD partners, and certainly we're working with our VA partners, and then the information that we're getting from our local partners that goes into our IIS system. So today we are at 68.1%. Yesterday we were at 68.0%, and prior to that it was 67.9%. So we're making progress. There is no doubt about it. But we've also said that nationally speaking, there has been a softening, a slowdown of momentum when it comes to initiation of vaccines. That is something that we are all concerned about in the public health community, and we want to do everything we can to encourage people to get vaccinated. The other thing I did want to point out, and I mentioned this yesterday during our briefing at Department of Health, that after the lottery and the incentives, the shot of a lifetime that was announced by the governor, we actually had, and if I remember the number correct, 87% of the calls that were coming into our state Department of Health hotline were for making appointments. And so we do think that incentive that the governor announced a few weeks ago, and certainly that Marissa received today in terms of her winnings, that is making a dent. It is helping. We just have to make sure more people are out there and getting vaccinated. So I'm hopeful. We're going to be pretty close, but the question is, are we going to be able to hit it? And obviously that's not up to me as much as it's up to all Washingtonians.
Look, we're in the nation as far as completed vaccinations. We've had considerable success relative to other states. That's a credit to Washingtonians who want to save their loved ones' lives. It's a credit to Washingtonians who have pierced through the massive misinformation that unfortunately they've been exposed to. They've been exposed to all kinds of deceptive lies about this vaccine. This is a life-saving vaccine. Hundreds of millions of people have had it. It has dramatically reduced this. 98% of the hospitalizations are people who have not been vaccinated out. It is incredibly effective. It is safe with almost no significant statistical deleterious effects. And Washingtonians have figured that out, even though they've heard lies repeated over the social media. And one of the things that's happening is people like Marissa are talking to their relatives and their friends and their sisters and their brothers. And every time that kind of conversation takes place, more lives get saved. That's why we're hoping people have more conversations about this in the upcoming days, even after June 30th. Now, we've also had success because we've been very diligent and creative, trying to make this accessible, trying to free information up. I'm pleased that our PSA won an Emmy 2 weeks ago for the work we're doing to share information for Washingtonians. So one way or another, we're pleased about the progress we're making. And the number I'm interested in is the number 1. And that means every single person who gets vaccinated is one more person who's going to be there at Thanksgiving and the holiday season instead of an empty chair. That's a success. And we're fighting for them every day for every person.
All right. Up next, we'll go to Laurel Demkovich with the Spokesman Review. Go ahead, Laurel.
Hi, Governor. Have you found the eviction resolution pilot programs, have they been effective in the 6 counties where they already exist? And if not, what is being done to ensure that there are enough resources so that they are effective when they expand to other counties?
I have not seen any comprehensive review at the moment, so we're going to have to get that and share it to you when it's available. But the good news is I haven't heard any reports of failure. That's usually a good sign when you stand up a new program that you haven't heard about problems. So, you know, so far so good, at least in my book. I can say the combination of federal dollars that are going to be raining down upon our local governments, there is plenty of resources to get these systems stepped up. We need some local leadership to do that, though. We need local leaders to carry the ball to stand up these processes. And we need them to do that because, you know, this is not a permanent situation. This is a transition to these programs. Landlords certainly will have a benefit if local communities step up to the plate and fashion these. So I'm confident that the political support for these from the landlord community will encourage local leaders to act here and not just sit on the dime and not get off the dime. So I'm reasonably confident this is going to get done.
Do you have anything you wanted to add on that one?
No, I don't have the data on the 6 counties. We'll look into that and see the effectiveness of them.
All right. Up next, we'll go to Austin Jenkins with the Northwest News Network. Go ahead, Austin.
Hi, thanks. I wanted to follow up on Joe Sullivan's question about the extent to which people are in arrears on rent. So you gave us the dollar amounts. Do you have the number, an estimated number of households? And I'm also wondering if this is in fact a moratorium, or is it more of a pause on evictions until August 1st? Really, the deadline is confusing me. This is in effect till September 30th, but it sounds like evictions can commence on August 1st if tenants don't fulfill certain steps. So, I think it's important for people who are in this situation to really understand what the rules of the road are going forward. If you could explain that better.
Well, it's not surprising that we'll have several conversations about this. It is kind of a bit complex. Now, one of the reasons is the legislature passed this, but didn't provide guideposts about what to do until these situations are actually in place. So I have had to create this out of whole cloth of this system. I think we've done a good job of that, but it has been not without challenges. So basically, if you think about this, after that date, August 1st, tenants do have to take some action to be free from evictions. They need to pay rent, or they need to reach some new agreement with their landlords, or they need to make an application at least to the rental assistance program. And if they do those things, then there won't be evictions going forward. For the past due rent, it's a different situation that does depend on standing up and accessing these dispute resolution panels if there isn't an agreement reached between the landlord and tenant. That's why it's important for these to get stood up for everybody's benefit. So it's a bifurcated situation between past due rent and rent going forward. We think these are reasonable for the rent going forward. For tenants, it's reasonable to expect tenants to, at a minimum, ask for rental assistance. And that seems to be a very reasonable request to avoid eviction. And we think that that'll be met largely with recognition of the broader public that that's a fair thing to do. Now, how you characterize this, whether this is a pause or a moratorium, I'm defining it as a bridge because it's creating a new structure to get us from here to there. I think that's the best analogy or metaphor that I can come up with. It creates a new system of legal obligations for this interim period to get us through COVID. And again, it does require cooperation of local authorities and local leaders, and we need to have that. I think we'll eventually get it, in part because local commissioners and judges are going to hear from landlords that we really need to get this system up and running. And I think once they hear those voices, they will get these systems up and running. Jim, do you want to add anything from the technical standpoint to that?
Yeah, a couple of things on this. So, Austin, we use two kind of metrics. Department of Commerce, and if you look on their site, they estimate that about 8% of all renters are behind on they're in arrearages on rental payments. That's down from about 13% earlier this year. If you look at the U.S. Census Bureau data, however, on the Pulse surveys, that number's higher. So, that number sits somewhere in the 8 to 15% range for persons that are in arrearages. And I think this is, to the governor's point, that's a lot of applications for local government to process. That's a lot of rent assistance to get out. At the local level, doing a great job trying to staff up, trying to do that in a timely manner, trying to put programs in place that are there. But this number is, just for kind of a frame. And again, it's a sliding sort of number, but that number's, in excess of 80,000 people that are in arrearages. On the high end, it's somewhere above 150,000. So this is the scope of the problem that the state is trying to address, that the Commerce is working with local governments to put through. But that's a lot of uptake for local jurisdictions to do. 28,000 of that has already been, renters have already been provided with something. But that leaves a significant number of people that are in the application process, waiting to get resolution on that.
By the way, I just want to reiterate, it is not a lack of money that is preventing this. So the money's there, it's just the process. So we have the money ready and willing to go. We just got to get the process in place. And now I do want to reiterate, we do need local leadership here to make this thing work. And so we're hoping we're going to get that. But these are achievable ends for tenants because there's multiple ways to prevent eviction here. And that's very important to us. We hardly want to see a wave of homelessness follow the end of this moratorium on June 30th. We don't want to have success reopening our businesses and then see a wave of homelessness. So we think that was the goal. I believe we will achieve it.
All right. Up next, we'll go to Brandon Block with the Olympian. Go ahead, Brandon.
Hi, Governor. We've been hearing about counties struggling to get this money out fast enough to meet the need from landlords and renters. Do you have any sense of how long it's going to take to get all this money out the door? I've heard just anecdotally from Thurston County that it could take as long as the rest of the year or potentially longer. So do you have any sense of how long this is going to take?
Well, first off, I do not. It depends in part on tenants' requests. How many people are going to make a request? It depends in large part on how successful the local leaders are standing up these systems. So I don't have a good estimate. It really depends on the extent of local leadership and the extent of tenants who avail themselves of this opportunity. I see no reason they should not. It's money like falling snow in your hat. But you never know. I mean, we have people not taking life-saving vaccines too, for reasons I can't understand. So it just depends. Jim, do you want to give any further guidance on that?
Yeah. So, Governor, I think you're right on point on this one. So there's, as the governor said, there's money out there. There's $500 million that's already been released. 127 million of that's already been processed through local jurisdictions to landlords on behalf of tenants for payments. That leaves about 175 or 375 million that's there with more money coming. It's really a factor of upscaling the ability to receive and process applications. It's the accessibility and the availability for people to make those applications and get those applications in.
I guess this is a little bit too much repetition. We need local leadership here. We really do. We could not solve this totally at the state level. Legislature's made the money available. I've provided the bridge protocol. But the third step is local leaders standing up these resolution programs. That really is key to the success of this program.
Right. Up next, we'll go to Joey Thompson with the Everett Herald. Go ahead, Joey.
Hi, Governor. Back to vaccines. Obviously, getting 68% of folks a shot is an accomplishment in of itself. But as you mentioned, you've tied reopening to vaccination rates. You got the lottery. We've got the mobile clinics. We've got the caravan. what else can the state do to try and reach folks who are still hesitant about getting a shot? And, Dr. Shah, is there any kind of estimate for what you think's realistic in the next few months, maybe looking on August 1, September 1st, where we might be?
100% real. There's no reason not to get this vaccination. Why the heck would you not get a vaccination that's going to save your life, is free, has no serious side effects, and has the added benefit of protecting everybody else that's around you that you love? Why would you not get this vaccination? 100%, less those who can't get it because they're immunologically challenged, or you have some religious conviction. There's no other reason not to get this vaccination. So we do have further things we're going to be working on after June 30th. Number one, we're going to have a much more robust effort to engage the medical community for them to share their scientific information with the public and with their patients. Several of the systems are doing that now. I was in a system, I've lost track, whether it was Yakima or Spokane, that are doing outreach. So they're actually sending emails and calls to their patients saying, hey, have you thought about a vaccine? This is safe, it works, let's make an appointment. Having more of our medical experts provide that outreach proactively to their patient community, we are going to make a really strong effort to see that that happens. And certainly every time someone comes in for medical advice, whether it's a toothache or an achy knee, we really are desirous of having the physicians and the nurses and the physical therapists to talk to the patient about the benefits of this vaccine and give them an opportunity to get it. We also are going to make it easier for physicians to do that because we're going to break up our supply chain, so we're giving smaller units so you can store it right on site of your physician. You've got it on hand, so when they come in for an achy knee, they can get their vaccine. And so we're changing our distribution model in that regard. We're providing an incentive for physicians to help on this by paying them for it through their insurance billing. We did that with Mike Kreidler's leadership last week. And we are going to have a very concerted conversation with the medical community in the next several weeks, asking them to be heroes. Look, they've been working really, really hard during this pandemic, long hours. And they're longer hours now because so many people are coming in who delayed their medical treatment for the last year and a half. So our nurses, our doctors, our phlebotomists, they're all working really hard right now. We recognize that. But we got to ask them to step up to the plate to help share information with their patients. And here's the reason. Their patients are running into a multi-billion-dollar deception machine on the social networks, spinning lies about this that'll make you'll grow horns on your head if you get the vaccine. And we are hearing this over and over and over again of a person say, well, my cousin told me she heard that people are developing cholera because of this when they got the vaccine. And look, I feel for people, they're reading this stuff. And so we need to really provide them the straight dope. And that's from the medical community, who are scientists, who don't have an ideological axe to grind, who aren't Republicans or Democrats, they're just physicians, and they want to save people's lives. So this is going to be a really concerted effort by us. We're going to be asking a lot of our physicians and our nurses, but this is a moment we really need them, and we're going to enable them as much as we can. That's the first thing we're going to do. Second thing we're going to do is we're going to bring the most important thing to any long-term endeavor, which is persistence. We are going to persist on this every single day. I get up every single morning trying to figure out how to get people good information and good access. And we're going to do that every single morning until this thing's over. And I've charged my entire administration to look for ways to do that. Third, there is going to be an increasing number of people who will recognize the benefits of getting vaccinated, not just that it saves your life, not just that it saves your spouse's life or your grandchildren's life, not just that it saves your grandparents' life, but it allows you not to have to wear a mask to work. Because after June 30th, people who are not vaccinated are still going to be required wearing a mask in indoor settings when they go to work. And we are seeing more people coming to that realization, geez, I can ditch this mask that kind of bugs me if I just get a vaccination. And we think that's going to be of increasing incentive. So there's reasons to believe that we will continue saving lives after June 30th. Did you want to add anything, Dr. Shaw?
Well, Governor, actually, I think you were quite comprehensive. The only thing I would say is, you know, one other, in addition to just watching the numbers and overall where we are with as a state, I think you mentioned this earlier when you were talking about the moratorium. We also are looking at our local partners, especially in communities and jurisdictions where we have lower vaccination rates, and really working to support them and to be able to do everything we can. But we really need to also lean on them to help. This is not just a state issue, this is an all of us issue. And that means that there are going to be certain communities that we are continuing to focus on and do everything we can to get, as a reporter asked about our caravans or our mobile outreach efforts or activities working with our local health departments. There are going to be a number of activities that we will continue to be focusing on. And, you know, I think this last mile, if you will, or this phase that we're moving into is really very much about really getting to those folks who know that vaccines are available, but for whatever reason haven't done it yet. And some of those are those who are hesitating, who may have confidence issues or getting misinformation, Governor, as you mentioned. And I think from our standpoint, those doctors and nurses and providers and dentists and all sorts of other folks out there, just having those conversations will help. But we also want to make sure that we're focusing on areas where you have relatively less penetration of vaccines, and that's where we're going to really lean on those local partners and really want them to help us, because this has got to be all of us. We would hate to have this tale of two societies, those who are vaccinated and protected and those who are unvaccinated, unprotected, and getting into trouble because we're still having those individuals getting hospitalized. So I agree with you. This is all about, it makes sense. It's free. It's available. It's right down the street. We can do everything we can to remove the barriers, and we've done that. But at the same time, we've got to also rely on our local partners to help us with this.
If I may, too, let me offer an explanation why we are so dedicated to this mission. I've kind of heard some people say, you know, at this point, people have had months and months to get vaccinated. And if they've chosen to expose themselves to a fatal disease and not avail themselves of this, you know, that's kind of up to them. And we shouldn't really care about that, because that's an independent decision. If they want to end up on an intubation and not being able to breathe, you know, that's their choice. Well, I got two answers to that. Number one, we do care about everybody, no matter what their ideology is or what their thinking is. We love people. We don't want them to see and end up in that situation. But there's another reason as well. Look, these variants, the Delta variant, more transmissible, maybe 40 or 60% more transmissible, and maybe more dangerous, particularly younger people. And we are already seeing in places that are not adequately vaccinated, including Missouri, you know, like 100% spikes over a short period of time of this disease. Now, if we still have, at the end of the day, you know, 35% of the people who are refusing this vaccine, and those variants come here, and they are coming here, and it is likely they will be dominant at some point on a likelihood basis, that means our ICUs get crowded again, and people who are vaccinated, who do care about their lives and their loved ones, want to have knee surgery, or if they're in a car accident, don't have a bed to go to, and they don't get medical care. So we all have an interest in everybody's health here. We're all connected when it comes to an intensive care unit at a hospital, and we all need to urge our loved ones to get this vaccine, because we have a stake on this who do want to take care of our health. We don't want to have to be waiting. If you're in a car accident, you can't get a hospital bed. And that's a realistic possibility because of these variants. I wish I could say we were done with that potential problem.
Up next, we'll go to Esther Bauer with KXLY. Go ahead, Esther.
Hello, Governor. Under the current moratorium, rent freezes are in place. Will these continue throughout the bridge, or can landlords start raising rent how much they want?
Jim, you want to answer that?
Sure. So in this transition plan, put my video on there. In this transition plan, it does not prohibit rent increases. That is something that was put out in staffing for the rental assistance dollars and the state and federal assistance that would come with those rental assistance dollars, but is not in the bridge strategy itself.
All right. Next, we'll go to Nicole Jennings with Cairo Radio. Go ahead, Nicole.
Good morning, Governor. I'd like to know, what are your thoughts on the continued closure of the U.S.-Canada border, especially in light of the letter that was sent to you by the fire chief in Point Roberts, talking about how, look, basically all of the businesses in Point Roberts are going to end up shutting down, and the community has essentially been destroyed financially by this closure. So what are your thoughts on the closure, and what would you like to see happen?
See the border open tomorrow, particularly vaccinated people, and I see no reason we can't do that. I'm disappointed that the federal governments have not been able to agree to reopen this border. I've been grievously disappointed. I've expressed that position in a number of ways, as forcefully as I can. The people at Port Roberts should be recognize that I have been worried about them and doing everything I possibly can to solve their problem for months now. And by the way, one of those folks said that somehow this is the governor's responsibility. I want to make sure you understand, the governor cannot open this border legally. It is a federal government decision. And for it to be open for U.S. citizens, it takes both the United States government and the Canadian federal government to open this border. So the Premier of British Columbia can't solve this problem, and I can't solve this problem. I didn't win the presidential race. Some think that was too bad. Most people didn't think it was so too bad. But I can't solve the problem without being president. So we're going to continue to be as aggressive as we can to urge this border to get open. It is obviously most acute for Point Roberts. I'll be talking to that community about nutritional needs and logistical needs in the next few days, about how we make sure that there isn't, real logistical problems that can't be met for the people at Point Roberts. But look, with these numbers of vaccinated people, I just see no reason why we can't, at least for vaccinated people, get this border open. It's very disappointing to me. And so we will continue to be as aggressive as possible. We have some allies in Canada, although it's not universal. There are some provincial premiers who are not in favor of reopening the border, even to vaccinated people, as I understand it. I regret that. And I think in the northern tier of governors in the United States, I think there's pretty good chorus, certainly members of Congress, who want to open up this border. So I'm a frustrated governor by this, and I will continue to urge both the executive branch and Congress to do this as soon as possible. And in the interim, we will look for ways, as we have, to assist these affected communities.
You wanted to add on that one?
I just wanted to build a little bit on the governor's remarks. The Point Roberts issue is one our office has been working on all through the pandemic. And earlier on, we were able to work with the Canadian government to get an exception for Point Roberts residents to travel for essential needs. They were exempt from the testing requirement. And we are having ongoing conversations about additional aid and ways that we can help the Point Roberts community, in addition to our continued advocacy that the governor mentioned for the border to be open from both sides, particularly for vaccinated individuals.
All right. We'll go to Casey Decker with CREM. Go ahead, Casey. Casey, are you there? Okay, we'll go ahead and come back to you. Up next, we'll go to Jessamine McIntyre with Q13. Go ahead, Jessamine.
Oh, hello. Can you hear me?
Yes.
Yeah.
Okay. Thank you very much. As we're reopening in a good time with low rates of transmission occurring in the warmer months, we'll hit 70%, but looking ahead to where we'll see increased transmission, holidays and gatherings in the fall, what would you need to see to prevent large-scale rollbacks? And do you think that there's a chance that we would ever see them?
If I understand your question, the past is pretty easy to relay, but the future is impossible. What I can tell you is we're trying to do everything humanly possible to enjoy the moment, and this is something we celebrate. We are going to open up our businesses on June 30th, if not before. That is something we ought to be happy about. We ought to pop the champagne corks or the juice or whatever you celebrate with. We ought to break out the flags. We ought to go to restaurants. We ought to celebrate with these small business owners who've been struggling for a year, who are now fully reopened. This is going to be a cause of great celebration for June 30th, and we ought to be happy about that. And again, we ought to pat ourselves in the back a little bit here too. Look, Washington has had maybe the 4th lowest fatality rate in the United States. We have saved thousands of people. We have helped businesses, struggling businesses, to the hundreds of millions of dollars through this bridge. We have helped tenants to keep them so they don't become homeless, and are continuing to do so with this bridge. We have had the 9th most successful vaccination program in the United States, and we want to be #1, of course. We have had huge relative success over the last year, and now we're at a point where we can get back to something that looks very, very close to normal. So look, this is a moment for great celebration, but it is also, and I believe we can walk and chew gum at the same time, a moment for realization that we got to keep up the work. We got to help more people get vaccinated. We got to keep wearing masks indoors if you're not vaccinated in a work setting. And we hopefully continue to talk to people we love, saying we love you. Get vaccinated. Don't believe the malarkey and the baloney that's on social media. Talk to your doctor. Because if you talk to your doctor, they're going to say, this is safe and it works, Harvey. Go get a vaccine. We love you. So we're going to do both things on June 30th.
All right.
Governor, just really quickly, I just want to add to your response to Justin's question, which is the truth is, it's really, as much as we increase our vaccination rates throughout the state of Washington, the less vulnerable we are to anything related to COVID-19, especially the Delta variant or other variants of concern. It is really up to all of us in terms of those increases in numbers. And we're seeing some counties, some communities that have had fantastic rates of vaccinations. We have other counties or communities where we are not seeing as much so. But even within counties where you've had success or have seen success, there's still pockets within those communities. And we want to make sure that we're addressing all those with our local partners, our community organizations, because ultimately, as the governor said, we want to celebrate this moment, but our work is not done. We've got so much work still ahead of us. And especially we are mindful of the fact that as we get into the winter months, which is not going to be that far off, we are going to now start to see more variants or people indoors, things of that nature, which now, again, if somebody is unvaccinated, they are unprotected and thereby at risk. So we want to do everything we can in the meantime.
Let me expand on that too. You ask about, our predictions of the future. I will tell you this. Here's one thing that will hopefully encourage people to persist in these efforts. We have counties today with very poor vaccination rates that are similar to Missouri today. And what's happening in Missouri today is they're having like 100% increases over a week or 2 or 3 of their transmission rates. That could happen to these counties kind of at any time unless we increase these rates. And we don't want to have a situation where well-vaccinated counties are in the clear and we've got 5 to 8 counties in our state whose ICUs are jammed and we have to be running ambulances to different counties. Don't want to be in that situation. That is a possible situation. And we will obviously act accordingly to save people if that starts to happen. So that's why we're going to celebrate on June 30th and wake up on July 1st still determined.
Last question. Time for one more. We'll go to Casey Decker. Go ahead, Casey.
Hello, can you hear me this time?
Yeah.
All right, great. Yeah, so Governor, you said with the past due rent in the bridge version of this moratorium, that landlords cannot evict tenants until there's an operational rental assistance program and the eviction resolution program. Does that imply that during this bridge, if both those things are in place, landlords could evict tenants, and at what point in the timeline would that happen if that was true?
Yes, if the resolution process, when that becomes concluded. So yes, after the resolution of that system and the hearings, and there's a resolution at that point, and if the tenant is unwilling to meet that obligation at that point, pursuant to that process, yes. Jim, is that right?
Yes, sir, that is correct. The remaining piece that comes out of Senate Bill 5160 is the right to counsel process. But with regards to the first two pieces of that and the proceedings, correct.
Thank you for people who are helping on this. Thank you for looking forward to June 30th. Thanks for helping us do it, maybe even earlier, but one way or another, we're going to have a lot to celebrate in the next week or so, and I'm going to be really, really happy about that. And it's a beautiful time to celebrate in the next week or so, including the Mariners' unbelievable streak here recently, Shed hitting 2 almost walk-off homers. So there's a lot to celebrate right now. And I hope people will be in a celebratory mood, but also be persistent. We know both are appropriate to the moment. Thanks a million.